excretion of calcium. And so if you increase excretion of calcium, then what would happen to your bones? You'll be getting, uh, you'll be leaning more towards osteoporosis. So that's why it is possible to see osteoporosis as an observed adverse effect of your adrenal steroids because of the effect of calcium. Okay. Um, which of the following is characterized by the existence of only one X chromosome in the female? One, Klinefelter syndrome. Two, virilization. Three, Turner's syndrome. Four, hereditary angioedema. And five, sarcoidosis. Just one X chromosome in the female instead of XX. Okay. All right. That will be the answer. Okay. Uh, among those choices, which one will be characterized by reticulosis? All right. That's the answer, sarcoidosis. And which one will be characterized by a defect in the C1 esterase inhibitor protein? Okay. And which one will be characterized by enlarged clitoris and male pattern hair growth? All right. That would be virilization. Virilization, enlarged clitoris and hair growth that follows male pattern. That is facial hair growth and all that. Exactly. Okay. Which of the following is an indication of androgens? One, fibrocystic breast disease. Two, anemia that stems from chronic kidney disease. Three, HSDD, that is hyperactive sexual desire disorder, HSDD. Four, endometriosis and hypothyroidism. hypogonadism, endometriosis and hypogonadism. And 5, management of postpartum, that is after delivery, postpartum engorgement of the breast. So which of those would be an indication of androgens? Mm-hmm. And you have some more. Okay. And some more. Are you saying number 5? Are you saying all of them, which will be 5 of them? B, C, E. Why did you skip D, as in David? Okay, it will be all of them. All of them. A person or an individual or a patient who has Cushing's syndrome will exhibit or experience which of the following? An increase in the urinary excretion of glucose, an increase in their intraocular pressure, moon phase, and ecchymosis. Buffalo hump and pendulum abdomen, and hyperkalemic acidosis. All right, that's the answer. It's all except E, because you would expect hypokalemic alkalosis. All right, very good. Which of the following represents a hypothyroidic state? Which of the following represents a thyroidic state? 1, cretinism. 2, myxedema. 3, Hashimoto's thyroiditis. 4, de Quervain's thyroiditis. DEQUER, de Quervain's thyroiditis. And 5, Plummer's disease. Which of those is a hypothyroidic state? Okay. Because Plummer's disease is hyperthyroidic state. Okay. I'll give you 3 sets of oral contraceptives, and you give me the progestin in those 3 products. Yasmin, Yaz, and Bayaz. What is the progestin in those 3? All right. Let's see. Overall, OVRAL, low ogestrel, and tri-leveling. What's the progestin? Talking about overall, low ogestrel, and tri-leveling. Okay, ogestrel. Lessina, 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 Livora, and Portia, Portia. Progestin there will be okay. Levonorgestrel. Azurette, Azurette, Azurette. Mircet, Mircette, Mircette, and Cyclesa. All right, the Sugestrel, that would be right. Okay. Loestrin, Norinil, Microgestin. The androgen there, the progestin there will be all right. Norethindrone. Okay. Which of the following can produce an elimination of menstruation for the whole year? Which of the following can produce an elimination of menstruation? 1, amethyst. Oh, okay. All right. We already saw the answer there from Sally. Okay. And what would be the benefits of, well, okay, let's put it in the question format. The use of amethyst may be beneficial in managing which of the following conditions? 1, PCOS. 2, epilepsy. 3, anemia. 4, menorrhagia. And 5, endometriosis. One more. Not PCOS. Okay. So basically, it will be all of those with the exception of PCOS. Okay. Which of the following can produce? Okay, let's restate that. A patient with a pre-existing hyperkalemia should not be given which of the following? 1, Inspira. 2, spironolactone. 3, Angelic. 4, Yaz. Y-A-Z, Yaz. And 5, Slynd. S-L-Y-N-D, Slynd. So you should exercise caution. Okay. One more. All right, so we have to go to generic name. What is the generic name for Inspira? I-N-S-P-R-A. All right, so do you see the suffix? It ends in what? Renon. And that was what we mentioned in class. Okay. And I know that you've come across that drug before because you were experiencing some difficulty in saying the name eplerenone during our discussion in class. Okay, so if it ends in renon, it will give you hyperkalemia. That was the whole point. Let me throw something out here. What is the generic name for Kerendia? A-E-R-E-N-D-I-A. A-E-R-E-N-D-I-A. What's the generic name? Okay, you look at the suffix, renon. That's another renon. So hyperkalemia would be an adverse effect of Kerendia. Okay. That's a drug you see used in chronic kidney disease patients, especially if their kidney disease stems from diabetes. Finerenone tends to help. Okay. Right, maybe we can go to thyroid. Let's see. Which of the following statements about the ADME of levothyroxine is true? Which of the following is true? One, it undergoes deiodination to T3 and reverse T3. Two, it undergoes enterohepatic circulation in the liver. Three, it can undergo glucuronide and sulfate conjugation in the liver. 4, it is mostly excreted through the feces. And 5, the half-life is 3 to 4 days in the hypothyroidic state. All right, that's correct. Okay, let's look at ADME of estrogens. Which of the following statements about the distribution and metabolism of estrogens is false? 1, Estron is converted to estriol. 2, estradiol mostly binds to sex steroid binding globulin, SSBG, sex steroid binding globulin. 3, estradiol can be oxidized by 3A4, 1A2, and 1B1, that is cytochrome P450. 4, the catechol that is derived from the metabolism can be inactivated by catechol O methyl transferase. And 5, semiquinones can be derived from the direct biotransformation of EES, ethinyl estradiol. Which of those statements is false? Oh, okay, that's right. That's number 5. It's only 5 that is false. That's good. Which of the following will result from the pharmacological action or effects of levothyroxine, that is T4? Which of the following will result from the pharmacological action or effect of T4? 1, an increase in heart rate. 2, an increase in stroke volume. 3, an increase in pulse pressure. 4, an increase in glucose absorption. And 5, an increase in peripheral vascular resistance. Okay. 5 will be false. That's right. Which of the following statements about drug and food interactions involving, T4 or synthroid is false? 1, food can decrease the GI absorption of synthroid. 2, levothyroxine can reduce the effectiveness of glyburide, that is oral hypoglycemic agent. 3, phenytoin or dilantin can increase the biliary excretion of synthroid. 4, prednisone will reduce, let's make it, will increase the binding of synthroid to thyroxine binding globulin. And 5, estradiol will increase the binding of levothyroxine to thyroxine binding globulin. Okay, that's the answer. The adverse effects of estrogens include which of the following? The adverse effects of estrogens include which of the following? 1. Increased fungal infections. 2. An increase in blood pressure and weight, that is weight gain. 3. Breakthrough bleeding. 4. Migraine headaches. And 5. Cramping and bloating. Okay, all of them. Which of the following is given orally 48 hours after the administration of mifepristone in order to procure abortion? 1. Onapristone, O-N-A, onapristone. 2. Misoprostol, M-I-S-O, prostol. 3. Telapristone, T-E-L-A, telapristone. 4. Sulprostone, S-U-L-P-R-O, sulprostone. And 5. Gemiprost, G-E-M-E-P-R-O-S-T, Gemiprost. So which of those will be given orally? No, it will not be all of them. So take note of the route of administration. Okay. So it will be misoprostol. Okay. Which of those will be given vaginally for that purpose? And which of those will be given IM for that purpose? Eh? You'll give sulprostone IM and you give gemiprost vaginally. Okay. Um, since we're dealing with mifepristone, let's see. Let's put it this way. Which of the following is an anti-progestin that is used to treat Cushing's induced hyperglycemia. Cushing's induced hyperglycemia. 1. Terlipreston. 2. Ondansetron. 3. Mifeprex. 4. Carlon. And 5. Misoprostol. Okay, that's the answer. All of the following are characteristics of the thyroid storm, with the exception of which of the following? Well, all of the following are characteristics of the thyroid storm, except A, confusion. B, fever. C, nausea and vomiting. 4, bradycardia. And 5, agitation. Okay, 4. So we'll be accepting that one. And which of the following is an estrogen tablet that is administered intravaginally? 1, Ogen, Ogen. 2, Femring. 3, Delestrogen. 4, Nuvaring. And 5, Uvafem. Uvafem. Okay. All right. And which of the following is a biosimilar estradiol and progesterone combination product that is used as an alternative to Prempro in the management of the vasomotor symptoms of menopause? 1, Combipatch. 2, Femhrt, Femhrt. 3, Bijuva, Bijuva. 4, Premphase. And 5, Premlo. Premprolo. Okay. It will be Bijuva, Bijuva. And what do you, well, let's talk about radioactive iodine. Which of the following statements about I-131 is false? I-131. Okay. 1, it is inexpensive. 2, you only need 1 to 3 doses to complete the therapy. 3, you don't need hospitalization. So hospitalization is not required to institute therapy with iodine 131. 4, it has not produced death, at least not reportedly. And 5, it does not increase the risk of hypoparathyroidism. Those are all true. Okay. Yeah, they're all true. They're all benefits. Uh, Triiodothyronine. Okay. Let's see, acne. Let's talk about acne. Uh, which of the following birth control pills is FDA approved for the treatment of acne? Okay. 1, APRI, APRI. 2, Estrostep. Now, Estrostep, Fe, comes with iron. 3, Bayaz. 4, orthotricycline. 5, orthonovum 1011. see for sure. Okay. Okay. So it will be Estrostep FE. That will be one. Bayers has also been approved for that. And orthotricycline is also approved. And then Trasprintec has also been approved. So among those choices, it will be those three. Bayers, Estrostep FE, and orthotricycline. Those have been approved. Okay, which of the following is a benefit of taking the combination oral contraceptives? A decrease in one, incidence of ovarian cysts. A decrease in the incidence of ovarian cancer. 3, an increase in the incidence of, a decrease in the incidence of fibrocystic disease of the breast. So we'll reduce the incidence of that. Or a decrease in the size of pre-existing uterine fibroids. And 5, a decrease in the heaviness of menstruation. Which of those will be the benefits of that you can derive from using combination birth control pills? Okay. All of them will be decreased. Yeah. Okay, let's put all of them as decrease. A decrease in the incidence of ovarian cysts, of ovarian cancer, and so on. A decrease in the incidence of those things. Okay. So the only thing it would not decrease is a pre-existing fibroid, uterine fibroid, because that's one of the disadvantages. Potassium iodide is not a component of which of these products? One, SSKI. 2, IOSAT, IOSAT. 3, iodopen, IODOPEN. 4, Thyroblock, CHYRO, block, BLOCK, and 5, Thyrosafe, THYRO, then safe, SAFE. Okay, that will be the answer. So we were looking for the one that has potassium iodide versus the one that just has sodium iodide. Okay. If you want to prevent pregnancy by maintaining an acidic pH in the vaginal environment, which of the following would you administer? 1, Annovera, ANNOVERA. 2, Opill, OPILL. 3, Phexxi, PHEXXI. 4, Ella, ELLA. And 5, Twirla, TWIRLA. Okay. So we'll give Phexxi. Okay. Anemia, anemia, anemia. Let's see if we can do some matching. The ones that are administered. Okay, let's see. Matching. All right. I give you the product. You give me the route of administration. Okay. Jatenzo. And this would all be testosterone products. Okay. So Jatenzo PO. Okay. Andropository, which is not a suppository. Okay, andropository will be given how? It's one of the esters of your testosterone. Andropository. All right, that's correct. Kaiser Trex. Okay. Zyosted. XYOSTED. Zyosted. Okay. And Testopel. Testopel. Which is testosterone pellet. All right, subcutaneously, okay. Which of the following is a low potency uh, adrenal steroid that is administered topically? One, desoxymethasone, that's Topicort. Desoxymethasone. Two, fluosinonide. Three, desonide. Four, amsinonide. And five, halcinonide, HAL, halcinonide. So which of those is considered to be a low potency? Okay, that's your Deso one. Which of the following products that one would not be okay? Let's just say which of the following products contains umeclidinium, UMECLI, umeclidinium? One, Trelegy ellipta. Two, Annuity ellipta. Three, Brio ellipta. Four, Advair, ADVAIR. And five, Dymista, DYMISTA. Okay. The Trelegy ellipta. And I'll give you a drug. You give me an indication. One, ADDY, ADDYI. ADDY is used for what? That we mentioned in class. Okay, very good. How about Vyleesi? Vyleesi. Okay, same. All right. How about stanozolol? Stanozolol. Stanozolol. Okay. What about ecallantide? ECALLA, ecallantide. Okay. How about icatibant? ICATIBANT. All right. How about decadurabolin? Yes. How about decadurabolin? All right. What about belimumab? BELI, belimumab. All right. Systemic lupus erythematosus. And you can also use afrolimumab. So belimumab, afrolimumab, those are beneficial in SLE management. Right. So let's look at the AOC to see what we have covered or not. Okay. Okay. So basically, we've covered them all. Um, what is prasteron? What's the generic name? Prasteron. Prasterone. Prasteron. While you're looking that up, look at uh, intrarosa. 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 Okay. All right. How about Osphena? Generic name OSPHENA. All right. You see that the indication for all of those is essentially the same, dyspareunia. Okay. And covers most of them. So pay attention to the sequence of events in the mechanism of action of all those uh, steroidal agents. Drug comes in, goes to the nucleus, binds to the receptor in the nucleus. You get dimerization, and then a response element is joined to that at the active site of a gene, and then co-activators can be attracted. Then you get histone uh, acetylation, and then you get remodeling, and then you get your polymerase, invited to that active site, and then you get transcription, and you get a protein, and you get an effect. So pay attention to that pathway because it's the same for all those hormones that we discussed. Okie dokie. Questions? None. Then we bid you a good evening and enjoy your basketball games.